The Surrey Heartlands General Practice Development Toolkit addresses critical challenges in modernising primary care while improving efficiency and patient outcomes. Amid increasing healthcare demand and limited resources, Surrey Heartlands aim to proactively equip general practices with tools to streamline operations, implement innovative solutions, and enhance both staff and patient experiences. General practices across the country are facing significant challenges, including the need to modernise services, optimise digital tools, and work more collaboratively. These pressures, driven by national healthcare demands, have impacted service delivery, affecting both patient access and clinician capacity. In response, a solution has been developed for Surrey Heartlands to support local practices in addressing these challenges, ensuring they can operate more efficiently and effectively within this evolving healthcare landscape. The development toolkit was designed as a localised response, comprising 3 face-to-face workshops and tailored follow-up support to enable practices to implement transformative changes. This programme complements the National General Practice Improvement Programme, aligning with Surrey Heartlands' unique needs while addressing the fuller stocktakes priorities, improving access to care and ensuring continuity for patients. It was initiated before the release of the Primary Care Access Recovery Plan ambitions, but is particularly aligned with the modern general practice agenda, reinforcing efforts to enhance efficiency and patient care. Key focus areas included modernising general practice, such as adopting online triage and remote consultations, implementing digital innovations like cloud-based telephony, supporting at-scale operations to enhance resource sharing and efficiency. The programme ran in waves, engaging nearly all practices in Surrey Heartlands. Each practice received funding, follow-up visits, and action plans for continued transformation. Peer-led workshops led by local GPs, 4 local GPs focused on key areas, including efficient consulting and data-driven appointment management, exploring shared resources and addressing failure demand, enhancing continuity of care and managing long-term conditions. Dedicated leads and peer networks facilitated collaboration, while resource libraries and webinars provided ongoing support. For instance, webinars on total triage shared insights from successful implementations, offering tailored guidance for practices of different sizes. The toolkit was vital for supporting recovery in primary care while fostering innovation. It empowered practices to handle increasing demand, modernise service delivery, and improve both patient and workforce well-being. By leveraging local expertise, the programme ensured practical, sustainable changes aligned with the specific needs of the Surrey Heartlands community. Across the ICB, there have been a huge number of achievements, including rebuilding patient participation groups, PPG, with a focus on demographic representation, rolling out a new triage model, shifting demand from phone lines to online platforms, implemented robotic process automation, RPA, for bloods and registrations, achieving significant time savings, reduced DNA rates from 4% to 1% by offering same-day patient appointments, introducing overflow clinics to meet additional demand, improved long-term condition management, and successfully mapped unplanned appointment activities using the toolkit's GPAD guidance. As of February 2024, 96 of 101 practices had engaged with the programme. Practices in earlier cohorts received funding support, 87 pence per patient for sign-up and 90 pence following follow-up visits. Tangible benefits include a significant increase in NHS app usage, with a 48.74% higher login rate than the national median, 566.77 per thousand versus 381.06, alongside improved triage practices and a rise in online consultation volumes. Patient feedback from the GP Patient Survey, GPPS, highlights the growing recognition of online services as a key access point, reflecting the programme's success in enhancing digital access and patient engagement. In Phase 2 of the Toolkit, the aim has been to identify and understand long-term GP attenders. Across Surrey, with a population of over 1 million people, around 40,000 of these are regular attenders. That represents more than 500,000 GP appointments every year. So far, at least 23,000 of these patients have been made visible within their practices. Targeted interventions, including continuity of care, will lead to better health outcomes and resource use. This includes identifying cases of failure demand, where patients return repeatedly due to unresolved issues. By encouraging practices to review their continuity of care processes, we have seen reduced and more focused GP attendance, freeing up capacity and improving care quality, lower A&E visits and emergency admissions, ensuring better long-term health outcomes for these patients. With quick start solutions for visibility, continuity, and change, we are creating a more efficient, patient-centered system that benefits both GPs and those they serve. For more information on this project, contact Surrey Heartlands via email syheartlandsicb.heartlandsprimarycare@nhs.net.